Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications, and of course, one of your MCs here at Gold Learning. I'm so happy actually to be here today. We've just been listening to Sinéad, who you can see on the screen with me, and she is just an amazing human and specialist in the work that she does. And we've been talking all about managing pelvic organ prolapse after birth. And why have we been talking about it? Well, Sinéad is back with us. Sinéad Dufour is back with us here at Gold Midwifery Online Conference 2025. Thank you so much, Sinéad. It's a delight to have you back here at Gold.
I'm delighted to be back. Thank you so much, Fiona.
We were just saying off camera, there's just so much to learn in this area still. It continues to evolve. You were talking about a lot of research today. Let's dive into some of those really hot topics that are coming out right now for you that you want to share with people. Tell us, what have been the shifts and changes for you over the last few years?
Yeah, so what I would say specific to prolapse, which is what I was talking about today, one of the biggest shifts, I would say, is around one of the care strategy options, which is pessaries. So pessaries are silicone-based intravaginal tools,
right?
Really designed to kind of support the optimal position of those organs that are kind of losing sort of their support. And historically, we have thought of pessaries as in ways almost like an end option, like kind of try all the other things first. And if nothing works, maybe we can use a pessary and really just to kind of ameliorate your symptoms, but not really as a curative care strategy. But now we have data to show that unlike any other ligament structures in the body,
right,
if we kind of support those structures to enable them to shorten, they actually do shorten. So we're starting to see this with pessary care now. And this is really exciting because people can start to understand, well, actually, if I use this earlier in my recovery journey, I can actually use it to help heal and recover the tissue rather than being something I just need to kind of use for the rest of my life. And so we're seeing these being used more often in pregnancy and the early postpartum, very much kind of through that lens of restoration, which I think is really, really empowering. So that's been one thing that's been really exciting.
Yeah, it's so interesting you say that about pessaries, because as soon as it comes to my mind, I feel like, pessaries I feel like they've been around for a very long time. Correct me if I'm wrong. But also, I feel like maybe my mom's generation, I feel like they did talk about them, but almost with a sort of a slant, like it was, we didn't really want to talk about it because it wasn't nice or it wasn't good or positive. And now I feel quite empowered after listening to your presentation today and hearing the research on these pessaries, the value, the importance, and really the low risk, in using them. So is that something like you're having to change the narrative, I feel, a little bit on them?
Absolutely. And what I would also say, too, is you're quite right. Like the pessaries we have today, not only do we understand they have more of like a healing and even preventative mechanism, but they're designed so much differently now.
Right.
The pessaries of decades ago, unfortunately, weren't the most comfortable. There weren't as many different styles. And there wasn't the consideration to comfort and the other tissues in the pelvis. And now we are considering all those things. Like, what is a woman's experience with having this? Is it really comfortable? Do we need to plump up those tissues a little bit more with a hyaluronic acid moisturizer? Do we need to kind of actually get one that's a little bit more flexible? There are now some pessary companies that are actually doing individualized custom pessaries. So we're coming a long way, and I think we're going to see even more evolution of these tools. But you're right. There are sort of notions held about pessaries from previous sort of versions, and we're dealing with like the version 2.0, and we have to kind of work to change the narrative. It's a really good menu option. The other thing I would say is with pelvic health physiotherapists, being sort of more prominent in assisting with this type of care, we're another provider group that fits pessaries. And so that's another avenue to make this type of care more accessible as well.
Yeah. No, it really, I mean, just for me, thinking about the historical value behind it. And yes, we're moving into this whole new framework. We've got research to show it. The other factor is that it has felt very, I guess, boxed in when it comes to physiotherapy, prolapse. And, you very clearly said it is not one shoe fits all. In fact, even when you were talking about using the pessaries, you need to try several. And so I think there's been this inability to sort of, really sort of spread our wings in this sort of area, if you like, to learn about the pelvic floor, that we're not all the same. Gosh, it totally makes sense, but we've been treating clients all one way for so long that it needs to be this dynamic, sort of intervention now, which really is very exciting because, it totally makes sense when you say it out loud, right?
Totally.
But yeah, I feel like, that hasn't been in practice. So you must be excited to sort of share, because you teach on this as well. So, teaching the fact that, yes, we need to be dynamic when we're, teaching, treating an individual. Is this sort of exciting your students as well?
Yeah, it is. So, I mean, I'm quite lucky at McMaster University. I have a chance to teach with the midwifery program as well as the family medicine residents in the School of Medicine. And always sort of one of the points I'm trying to get across in my teaching is trying to get them a way of thinking, well, right now I'm treating prolapse and I'm assessing for prolapse. And I'm trying to say you care for people. And, this is one of the things someone is likely going to come with. If they've had some of those things happen that we know are independent risk factors, they've had a forceps assisted birth, they've had these other things, and they're telling you they feel heaviness and they're scared.
Right.
Well, then this is one of many things that needs to be on your mind that we need to take a check for. And then we need to reassure this individual that prolapse is something that actually happens more over time. So if we can get in there right now with loads of supportive options and things that work with that person, we can help with the prolapse. We can help with the fear related to movement and exercise. We can help with like the incontinence we can help. So very much I feel very, very blessed that I do get to teach those different groups, because I do think we need to be a little bit more dynamic and sort of whole person in our thinking and our care provision.
Yeah, well, it's exciting. I think that, we've talked about whole person care in so many different areas, but clearly this is an area that still is growing, still developing. I'm so glad that you are catching the next generation. And I think the demand in the community has definitely gone up too, as we've started to explore, and we're teaching our clients to reach out to pelvic floor specialists and things like that, particularly in the immediate postpartum period. And they're not waiting. There used to be this big waiting period. And we're trying, we're trying very hard to say, like, don't tolerate it, keep searching, and so forth and so on, which is, so exciting. At the very beginning, and I'm going to give people a little bit of sneak peek into your presentation, you talk a little bit about, how common it is, and because I think, again, because it's maybe something that is not completely open, in conversation, I think people still shy away from, even as a patient, we don't always see them immediately talk about how they're feeling in the pelvic floor. It needs to be initiated by, by the provider. So it's fairly common, you're saying, Sinead.
Yeah, it's interesting, Fiona. I mean, when I took my first pelvic health sort of advanced training course, when I decided to credential in this area, and that was like well over a decade ago now, it was one of the first things we learned was that, urinary incontinence was 1 in 3 over the lifespan, and pelvic organ prolapse was 1 in 2.
Right.
And I'm embarrassed to say I hadn't even heard of pelvic organ prolapse at this point. I had already been a physio for a decade. And I thought, you know what? I don't think that's right. Like the sort of skeptic researcher in me. But I have to say, it showed very quickly in practice it is more prevalent than urinary incontinence. And now the data is sort of more clear. So yes, it is a common issue, but I think because the symptoms are a little bit more silent, like with urinary incontinence, there's kind of that obvious urinary leakage.
Sure. Yeah.
It's why one of those outcome measures that I mentioned in my presentation that really kind of casts the net wide to catch all different sort of versions of sort of pelvic dysfunction, and it captures some in prolapse. I really do think in the perinatal period specifically, we need to be paying attention to issues with the pelvis.
Right.
And I really think we do, to your point, have an onus to ask those questions. Just run the questionnaire, right? Because it will elucidate, there's no leaking, there's no obvious things, but they're saying there's a bit of heaviness. They're saying at the end of the day, they're feeling this. They're saying that, right? And then it gives you an opportunity to then springboard and dialogue. Tell me a little bit more about that. And how is that actually affecting you? What does that look like in your life? Yeah.
Yeah. It seems like that just should be standard of care.
That's what I think.
Yeah. Things like that, perinatal, postpartum, breastfeeding, it should be all tied in, to those factors. I think it's so important because I think it's, like you said, subtle enough that, in the immediate postpartum, there's so many things going on that it could be missed or maybe just not brought up in conversation because there's other priority things happening. So, I'm excited to see where this can go and how much preventative medicine really we can put in place. This is, you're talking about lifelong, problems here. And so I'm so happy to have you here, and having a voice in this community. So thank you so much. Again, your presentation, Managing Pelvic Organ Prolapse After Birth, such an important topic. Everybody needs to come and listen to this one for sure. Appreciate you so much, Sinead, for being with me here today.
Thanks so much, Fiona.
And for everyone listening, and don't forget to head over to our website, goldmidwifery.com. Right now, you can check out all the latest content that we have on our website, including our upcoming conference and event. And of course, Dr. Sinéad Dufour will be here with us as part of this conference. Thank you again today to Sinead for being with us here today, and to all of you for listening in. It's lovely to have you. See you again soon. Bye-bye for now.